Today I'm going to demonstrate setting up a sterile field. I'll start with my sterile drape and I will peel it apart at the edges to open my package. I will stay away from my field as I open my package. Open it and then drop it directly on the table and dispose of my packaging. Then I will open up my drape all the way with the seam, closed seam facing me. So I want it to actually be the other way. Okay. I will grab it now on either edge. This is the side that will be facing down on the table. So I want to always make sure I have a 1-inch border when I pick up my towel. So I'll lift it up and drop it down. I'm demonstrating how to set up a sterile field. I will start with my sterile towel drape and I will open my package, peeling it apart and dropping this directly onto my table and dispose of the packaging. I will open up my sterile drape with the sealed seam side of the drape towards me. This side is the side that will be down on the table. Lifting it at both edges, I'll pick it up and drop it right down. Okay. Once I have my sterile field, I can start to put the other sterile pieces that I need in order to complete a dressing change. This is my sterile bowl. And again, standing away from the field, peel it open. Then I can take the sterile packaging, hold on to the bowl, lift from behind, and just drop that on the table. This is my sterile cling, which I will use, also peeling apart, lifting, and dropping. Sometimes it may take a little longer, so always try to stay away from the field to make sure it's going to be ready to pack, to drop in. You do not want to hover at any time over the field. You'll take your suture removal kit. Again, you'll peel the paper away, and then you will take this and drop your scissors and forceps onto your sterile field. Notice I do not turn my back on my field at any time. I always have to be aware and watching. I will peel open my sterile 2x2s. I have 2 packages of these. And I will open them. Again, I'm stepping away from my field till I'm ready to drop them on, at which time I drop. The next one, same thing. I will pick up my packaging, peel it open, and get ready to drop this on my sterile field. I have a sterile 4x4, which I will also need to put on my sterile field. Opening it, making sure I don't touch the insides, and drop it on my field. I also will put my sterile Q-tips. I will need these for later, one for packing the wound and one I can use for measuring the wound as an option. There's another way of measuring the wound, which we can talk about after I complete this. But for now, I'm going to open this and I'm going to grab this from the sides, peel it down, and drop them, if I can, onto the field. That was not so good. So you can see what's not always such a good way to do it. Make sure you peel this all the way down. Do not touch. And there's my sterile. I did not touch anything. It was not pretty. Let's work on that for a better attempt, but we did it. Next, I will go ahead and put my sterile water into my cup that I'll use for cleaning the wound. I check it for date, time, and initials, it's good for 24 hours. If it's brand new, I will date, time, and initial at the time that I'm opening it. If it has been opened, I will cup my fingers over the label, unscrew the cap, lip it, which is basically just cleaning the bacteria off that side of the bottle, and then I can go in without reaching over my field and pour my saline into the cup. Then I put my lid back on and step back without turning my back on the field. Now at this time, my table has to be at an elevated level so that the patient's covers are not hitting the sterile field. And I'm going to move this down just a wee bit so I have room to put on my gloves. I do not need to put this tape on there, that is not sterile, and so I'll save that for last when I tape up my dressing. Next, to apply my sterile gloves, I'm going to open my packaging, peeling it apart, and removing my gloves. I will open the gloves, the top and the bottom, so that you do not want your glove packaging to flip back onto the field because it would become unsterile. So I'm going to grab, I have the edges here, they're considered the 1-inch border, and I'll open my package and go ahead and get my gloves on. Okay, so I'm dominant left hand, so I'll go with my left hand first. Lift it up off the package. This is the side that will be turning onto the inside of my skin, so I can grab it because it will not need to be sterile. And pull this down a little bit over there. Next, with my sterile hand, I'm going to grab this glove underneath the cuff, lifting it up. I have a thumb, we call that our hitchhiker thumb, that you keep out of the way while you now go ahead and put your other hand into the glove. At this time, I can fix the fingers to be the correct place because I am all sterile. So sterile to sterile works, and you can adjust your gloves as needed. Okay. I would just get rid of that so that there's no chance of it rolling onto my drape and contaminating. I'll now get my supplies in the correct order that I'll need them, and I'll need my 2x2s, and these I use to clean the wound. So 1, 2, 3. I only need 3, so I can set 1 extra there. And then I need my sterile gauze, and this too will go into my water. So I'll pop that in the water, and I use that to clean the wound. Okay. This concludes setting up a sterile field.